Welcome to NCLEX Map, your go-to channel for mastering nursing concepts with clarity and confidence. Today, we're diving into a crucial topic: seizures, what they are, their types, and essential precautions. By the end of this lesson, you'll know how to classify and manage seizures like a pro. Let's kick things off with the basics. What is a seizure? A seizure is a sudden, uncontrolled electrical disturbance in the brain, affecting behavior, movements, and consciousness. It happens when clusters of neurons fire abnormally and excessively. Seizures can be provoked by issues like fever or head trauma, or unprovoked, often linked to epilepsy. Now let's talk about the types of seizures according to the latest classification. Focal seizures start in one hemisphere of the brain, and if awareness is intact, it's a focal aware seizure. If awareness is impaired, it's a focal impaired awareness seizure, often showing lip smacking or blank stares. These can escalate to bilateral tonic-clonic seizures, which involve both sides of the brain. Generalized seizures affect both hemispheres from the start and can be motor or non-motor. Motor types include tonic-clonic and myoclonic, while non-motor types include absent seizures, where the person stares blankly for a few seconds. Unknown onset seizures are those where the start isn't witnessed or recorded. So what should you do if you see someone having a seizure? First, ease them to the ground and turn them on their side to keep the airway clear. Time the seizure and remove any nearby objects to prevent injury. Never restrain their movements or put anything in their mouth. This can cause harm. Call 911 if the seizure lasts more than 5 minutes or if it's their first seizure. In the hospital, keep the bed low, side rails up, and remove sharp objects. Have oxygen and suction equipment ready and maintain an IV line for quick access to medications. After a seizure, place the patient in a side-lying position and monitor their vital signs. Document everything accurately, including onset and duration of the seizure. Now let's discuss status epilepticus, a medical emergency. If a seizure lasts longer than 5 minutes, it's critical to act fast with benzodiazepines like lorazepam. If they remain unresponsive, escalate to second-line medications and prepare for airway management. Educate clients and families on the importance of taking anti-seizure medications as prescribed. Avoid triggers like lack of sleep, flashing lights, and stress to help manage seizures. Using seizure action plans and medical ID bracelets can be life-saving. And remember, never swim alone and be cautious with activities like driving. Let's wrap up with some NCLEX practice scenarios to reinforce your learning. Scenario 1. You see a patient having a tonic-clonic seizure. What's your first move? Correct answer: turn the patient on their side to protect the airway. Scenario 2. After a seizure, what's your priority? Correct answer: check for injuries and position the patient laterally. Scenario 3. If a client has been seizing for 6 minutes, what do you do? Correct answer: administer IV lorazepam immediately. Scenario 4. A client reports lip smacking and in confusion for 2 minutes. What type of seizure is this? Correct answer: focal impaired awareness seizure. Scenario 5. A client skips their evening dose. What's your response? Correct answer: consistent medication helps prevent sudden death and injury. Key points to remember: classify seizures by onset and awareness, protect the patient, and act fast in emergencies. Thank you for joining me on NCLEX Map, where we turn nursing knowledge into confidence. If you found this video helpful, like, share, and subscribe for more high-yield NCLEX content. Together, we're mapping your path to success, one concept at a time.